Hello, and thanks for listening to another update on COVID-19, this time recorded on the 28th of April, 2020. So the topics I'd like to discuss this time are, first of all, the question about how many cases we might be missing of COVID-19, particularly in Australia, a bit more data on the safety of going outside versus being indoors, a look at some recent information about the antiviral drug REMDESIVIR, a discussion on the correct use of masks and gloves, and an ERRATUM section. So the first question is, how many cases of COVID are we missing? So obviously we're doing lots of testing and we're finding lots of cases, over 3 million in the world now, but how many are we missing? So you might have seen that there's some stuff coming out in the media and also in the medical literature recently about some antibody surveys. There were two done in California recently where they used a finger prick test, which is like a point of care test, and suggesting that they were finding a lot of people with antibodies to COVID, a lot more than they knew about by swabbing, and suggesting that based on this, there might be as many as 50 to 85 times as many cases as that we previously thought about based on the results of swabbing. And suggesting that based on this, maybe because there was a whole lot more cases, that maybe the overall death rate was in fact lower. Now, is this study believable? I think the short answer is no. So first of all, there's a few criticisms of this. So firstly, it was not a random sample of the population. They did advertise to people on social media to say, well, if you're interested, come down to this place and we'll do this finger prick test on you. So by doing that, you're going to attract a population of people who, are perhaps ones who had a compatible illness earlier on and were unable to get tested at that stage, who then were interested to know, was that previous illness likely to be COVID, and then B, on top of that, more likely to get people who are willing to go outside, who therefore are more likely to get infected than people who are taking the lockdown more strictly. Secondly, these tests, these point of care tests, have been shown to be not all that accurate compared to some of the other tests we do. And in terms of their inaccuracy, the problem is they have both false positives and false negatives. And there is a concern that with these types of tests, that maybe they're not just detecting the presence of antibodies against COVID coronavirus, but also possibly some other types of some of the more kind of normal standard coronaviruses that circulate in the community and just cause like a cold type illness. So we don't necessarily know that these tests are just detecting the presence of antibodies against COVID-19. And then I think probably the strongest argument against this, particularly this argument that maybe the death rate is much lower at 0.1% of all cases, is the experience from both New York and London, where already in those two locations, they have had more than 0.1% of their entire population already has died from COVID disease. And that's at a time when they're still getting plenty more cases. So it's not like they're just about having everybody infected already, and so that they're kind of running out of people who can still catch it. So they're still getting many more cases there, even with the lockdown. And so the fact that they're already at more than 0.1% of their population actually dying at this stage would suggest that this figure is not likely to be real. So it's hard to compare countries in terms of the likelihood of missing cases. And I think probably one of the ways to look at this is to compare the hard hit countries with those that have been less hard hit. And so if we look at the countries that have been harder hit, so some examples here being these 5 countries, US, Spain, Italy, France, and UK, and you can see the numbers of cases listed in this column here. And then I think what is really telling in terms of how many cases you're likely to miss is these 2 columns on the right. So first of all, the percentage of tests that are done that turn out positive. And in all these countries, it's kind of lowest is about 11% in Italy, but gets up to 35% of all tests they're doing in France are actually positive. So that's a really high rate compared to what you'll see in the next slide. And then on top of that, the case fatality in these countries, where that is the number of deaths divided by the total number of cases that have been identified, is very high. So the lowest one here is 5.7% in the US and up to 14% in France. So that's a really high fatality rate for what we think is actually occurring with COVID. So if we then move on to the countries that have been less hard hit, so some examples being Singapore, South Korea, United Arab Emirates, Australia and New Zealand, where there's certainly fewer cases in this column here. And then if you look at the numbers of tests that are positive, it's still reasonably high in Singapore at 11.8%, but all these other ones are at much more in that 1 to 2% range. And I think probably that's what you want to see, that if you're doing enough testing for your country, you're probably only going to have 1 to 2% of your tests are positive. The second column then is also the case fatality rate in these places is much lower, so only 0.1% in Singapore, and that's by far the lowest. that may be a little bit undercalled at this stage because they've had a lot of recent cases in Singapore, in particularly in younger people living in some dormitories that are very close together. And so they've had a big outbreak in Singapore after having controlled COVID recently. And so because a lot of these cases are very recent, maybe the potential deaths that are going to occur out of these cases haven't yet taken place. So maybe this 0.1% figure will likely rise later on. But all the other places in this list have death rates around the 1 to 2% range. And I think probably that's what we're going to find in the end is likely to be the overall death rate for COVID-19. So if we look at Australia, again, to do with this question of are we doing enough testing to find all the cases. So you can see on this left-hand y-axis is the numbers of tests being done a day, so these pink columns. And so it tends to be around the 12,000 tests done per day in Australia. And then the right-hand column here is the number of identified cases per day. And so that's this black line with these greenish dots there. And so we're seeing very few cases now. So we're down to kind of less than 20 cases per day being identified, despite doing more than 12,000 tests a day. So I think it's fair to say we are doing a lot of testing and we're finding very few cases, and we're maintaining the numbers of tests that we're doing, even as this appears to be getting lower in Australia. Okay, so now moving on to the next question about some bit more about data on whether it's safer being outside than inside. And so there was a recent Chinese study where they looked at transmission clusters. So that's where you've got one identified case to start with, and then looking at where they have then passed on to at least 2 other people to get into this study. So this was in the area around Wuhan, and they found 318 transmission clusters that they could study for this. And of those 318, only 1 occurred outdoors, and all the rest were in indoor locations such as homes, within workplaces, public transport and shopping areas. But yeah, only 1 out of those 318 was outdoors. I guess the question does remain, though, that is not answered by the study, is were there many people outdoors? Because this was in January and February in Wuhan area. And so we know that there was a fair bit of lockdown at that time. So I'm not sure how many people there were outdoors to say whether this is a definite indication that it's much safer outdoors, but I think it does add to the suggestion that this is much safer than being indoors with people who may have COVID infection. And then slightly related is some more data out of South Korea. So if we're looking at transmission from people who are symptomatic, obviously that does take place. So people who've got symptoms of COVID definitely pass it on. And people who are pre-symptomatic, so someone who's tested positive and then their symptoms actually start in the next couple of days after that. We know there are examples of that being a potential risk, and people who are about to start having symptoms definitely do pass it on. But the question from this recent data from South Korea is whether people who are truly asymptomatic, so they've tested positive, but at no stage do they have any types of symptoms consistent with COVID illness. And this group in South Korea, at least, they felt that there was almost 0 cases of secondary infections from the people who remained asymptomatic throughout. So they had a positive test, but never got any symptoms. So there have been some examples of these asymptomatic people passing on, very rare, but I think overall, probably this asymptomatic group, that's a concern because it's very hard to control an infection where asymptomatic people are passing on because they're so hard to identify. And so the fact that we're finding so few when the South Koreans were doing a lot of screening, I think that is relatively reassuring that this group, whilst they may be a concern, you probably have to get very close to them to catch COVID from them. And by very close, I'm talking about kissing or sharing a drink bottle, but they probably don't appear that they're kind of breathing out the virus so that you're able to inhale it directly from them. So I think it's slightly reassuring that these group are not likely to pass on all that much. So the next topic is that of remdesivir. So this is an antiviral agent with the aim to reduce viral replication within a person. So this drug was first tried in the recent outbreak of Ebola in the Democratic Republic of the Congo and didn't have a great effect there, in Ebola infection at least. So it's being tried here because it does have some general antiviral properties. And just over a week ago, there were some rumors going around social media that this was looking like it was actually doing some good in some patients with COVID infection. However, there's been a leak of one of the trials of this now, and it looks like probably it's not all that useful after all, and that probably the side effects exceeded the benefits of the drug. So that's a bit disappointing as well. So unfortunately, pretty much all the antiviral drugs that we're thinking about this are looking like they're not going to help a whole lot. So which means that in terms of kind of vaguely antiviral effect, we've just got that kind of plasma therapy. So taking someone who's fully recovered from COVID infection, taking some of their blood and taking their serum or plasma from it, and then giving that to someone who's very sick, that's probably kind of the only antiviral therapy that we're looking like probably does have some benefit. It looks like in some recent studies that the benefit of this plasma therapy is probably better if it's given earlier in the illness, when the person's just starting to get very sick. You wouldn't give it to people who are kind of just mildly infected. So that's kind of really the only therapy that we're seeing at this stage is likely to be all that useful. The other one is a drug called tocilizumab, and that's really for the people who are very sick in intensive care, and you wouldn't give it to people who are mildly infected. Again, it's just for kind of trying to salvage things when people get very sick and are starting to go into respiratory or lung failure. So then moving on now to a bit of a question about appropriate mask and glove use. So as I said previously, I don't think there's a huge role for masks if you're just going out for, say, a walk around the block and you're going to be outdoors. I think the risk there is so low that there's not really a whole lot of benefit from doing that. But if you're going to be indoors, say whether that's in a workplace or in a school, perhaps if they reopen, or in supermarkets, then yes, masks potentially have a role for that indoor risk of transmission then. But if you're going to do it, you need to use the mask right. And so do not do what this person is doing here of having the mask underneath your nose. It needs to be over your nose, and then there's a wire in the mask which then needs to be molded to the shape of your nose so that it does have a bit of a seal around that area. And then don't do what this person on the right is doing, which is touching the mask. So there's a double risk there. So one is probably, if you're breathing in and out through the mask, you're probably going to attract virus onto the surface of the mask. So you're then going to, by touching it, you're going to get virus onto your hands. Alternatively, you might have already touched something with virus on it, and then you're putting the virus onto the mask where it's much closer to your face. So you really don't want to be touching your mask or having your mask worn incorrectly. So just a reminder, if you're going to do it right. And the only part of the mask that you should handle is the arms of the mask that go around your ears. You shouldn't touch the cloth part of the mask itself that goes over your mouth and nose. And then for gloves, so the thought of wearing gloves is that obviously you're going to get virus on your hands by touching shared surfaces. And so therefore, would gloves offer some protection? So first of all, just a reminder that if you do get virus on your hands, that is not a risk like that. You can't catch the virus through the skin of your hands. The only way you're going to get it from your hands into you to cause an infection is by touching your eyes, nose, and mouth. So I don't think there's a kind of a big role for gloves if you're going to look after the hygiene of your hands by making sure that they're cleaned regularly. So the gloves will maybe remind you not to touch your face, and that's probably a good thing, but you can certainly get the virus on gloves, and probably, in fact, the virus will survive better in terms of a viable form of the virus, better on the gloves than it will on the skin of your hands, because when it's on your skin, it's got to compete with all the many billions and trillions of bacteria that live there. The gloves, they can have virus on them. So if you're going to wear the gloves, you've got to remember that if you're wearing gloves for a long time and then touching various surfaces, you're going to be potentially transmitting virus from all those different surfaces with the gloves. So if you're going to use gloves, make sure you're washing your hands both before and after the use. Do not try and reuse these disposable types of gloves. And just a reminder that do not touch your face. Whether or not you're wearing gloves, don't touch your face until you've made sure that you've washed your hands thoroughly with soap and water, or alternatively some alcohol-based hand hygiene. And finally, a bit of an erratum section. So last time when I spoke about why Australia has been relatively spared from COVID, one thing that was pointed out to me by some clever people afterwards is maybe the bushfires, as bad as they were for Australia over the summer period, they in fact had the effect for us in COVID, that the reduction in tourists arriving in Australia has meant that we had a delayed introduction of the infection, and so we're able to kind of learn from the mistakes of other countries and what had happened there, so that we're able to, once we acted kind of around the same time as many other countries, they'd had introduction a lot earlier than we did, and so that our actions led to a earlier break in the transmission of the infection, and so gave us a bit of a kind of a grace period as such. And then the second one is some recent data suggesting that the duration of contagiousness before someone gets symptoms. So initially we were saying it was 1 to 2 days, but there's some data out of the US recently where they were doing some swabs in people in nursing homes where they had been exposed, and that they found that the time between a positive swab being taken and the first symptoms might be as much as 3 to 4 days. And so if they are swabbing positive at that stage, then maybe it's possible that you could have 3 to 4 days of being able to transmit the infection before your symptoms start. So that's certainly a concern, that if that is the case, because that is obviously, it's harder to try and identify people who don't have any symptoms. And finally, so just like to say thank you very much to all the teachers. For my own kids who are doing their homeschooling at the moment, it's a real challenge, and I really appreciate all the work that the teachers are putting in to prepare all these classes online and the like Zoom type classes. That's been fantastic, and I know it's a lot of work, and trying to teach my own kids, both myself and my wife, finding how challenging that is. And so thank you to all the hard work teachers do to make that happen, and particularly how much work they do during the classroom, because dealing with 1 or 2 kids is challenging enough. Having a whole classroom, I don't know how you do it, but thank you very much for all your hard work. Congratulations all to New Zealand, cousins across the ditch who believe that they've probably eradicated COVID from their country, which is just fantastic if they can do that, and well done if they have managed to do that. That's a great achievement. And just a request, please keep up the social distancing for a bit longer. We're really doing well in Australia in terms of getting the curve flat, getting the numbers down, but we're not quite there yet. And if we can just maintain this energy for the social distancing for a bit longer yet, then we do actually have a potential chance that we can get this down to 0, and hopefully do what they've done in New Zealand and potentially eradicate it from here, and then just have to worry about it being reintroduced by travellers coming here from overseas. And then obviously having to quarantine them to try and stop any further spread from there. So we have a potential chance of doing this. So let's make this effort, keep up the efforts, keep up the social distancing, and thank you very much for doing that. And once again, thank you for listening, and hope you've found this interesting.